And so that reliance upon the network that's developed with the other physios experienced in this, they become sort of our mentors, if you would, and kind of as a collaborative approach. And that's really the new focus now, collaborative team care. You're not managing these alone. That's the other great thing about this. There's 2 or 3 eyes looking on the same patient and coming up with some other solutions. And when it's not progressing like we should, then those are ones we have to take a closer look at. And I think you and I had an experience, right, with one of my patients who, we thought traditional back pain. He'd been to Emerge a couple of times, sent home as it's mechanical, it's chronic pain. And he had a background of chronic pain, which will certainly make it complex. But I think you had seen him and gone through the diagnostic testing and said, Keith, check his hip. You know what? The guy had an occult fracture. I hadn't picked it up. No one in Emerge had picked it up. Now, in the heights of COVID, so there certainly was less hands-on from my perspective, but the bottom line was that was kind of a typical pathway, right? This guy's not progressing. So therein, I think, rather than putting up front all the testing, looking for that kind of case, front of the line, put them into the standard conservative, put them through the MAC method. And then if they don't progress, put the further testing at the back end. Huge savings in cost. I mean, we could talk about that for a whole other session, but yeah.